Hello out there in television land, and welcome to yet another edition of It's Your Health. Philip Benyo with my bride, bringing you the latest and greatest in healthcare information. Make sure you check with your healthcare provider before doing any of the things that we talk about here on It's Your Health. Right, sweetheart?
He's always right.
Oh my God, the medicine's working. We'll be right back after this brief commercial message. Remember, you're watching It's Your Health. Call our sponsors and say, I saw it on It's Your Health, and better yet, use their services. We'll be right back.
Welcome to the first section of It's Your Health, and you can see that Amazon has branded their process of delivering packages.
How about that one?
And now they're bringing the baby packages, which of course would surprise a lot of people.
Absolutely.
Now you're going to tell me to do the
Headlines?
Headlines.
Yes, I
No,
am.
I'm not.
You're not.
No. First of all, I would like to thank the men and women, and I don't know their names. I was in a waiting room, and they came over to me and tapped me on the shoulder and said, we watch your show all the time, and we learned so much from this show. Thank you. So I wanted to say thank you to them. I'm not done.
Well, I paid them to do that, but go ahead.
No. Then I was in another waiting room, and a woman stopped me, and she said, her name is Joanne. So, hi, Joanne. Joanne loves our show, always watches it, but she had advice for me.
Oh.
She said, keep giving it to him.
I paid her more.
I said, okay, that's a deal.
Okay.
All right. Now I'll do the headlines.
Thank you.
You're welcome. Health misinformation and disinformation are spreading more widely than ever. Misinformation occurs when a communication is laden with inaccuracies. And boy, does that happen all the time. And disinformation is more concerning because that means a bad person is passing along fake information, trying to manipulate the audience, trying to manipulate what you're thinking or doing. So what do you do about that, Doc?
Well, I really welcome patients who do their due diligence and check either on medications, treatments, side effects, whatever we're doing with the patient or their family, that they look into it a little further. And then we sort of sort out the pros and cons of it all. But usually information is better than no information at all.
Sure, but you take that information, especially if it's medical, and you take it to your doctor and say, is this accurate?
Of course.
Is this what I should be following?
Yep.
Okay, next headline. Dense breast tissue can hide cancer. Have you checked if you are due for a mammogram or if you've had your mammogram? When you get your report, you should be checking to see if it says you have dense breast tissue. I know that I get a letter from the doctor who reads my report to tell me I do, and I have to go for another test. Because the big thing is the dense areas show up as white, and that's the same color that cancer shows up as. It shows up as white. And that's why if you have dense breasts, you have to get the second part of the test.
Right. Usually we would recommend getting ultrasound imaging. And I think in some patients, if I could wave a magic wand, we should really be getting MRIs because I think that's going to be telling us more. And so hopefully in the future we may be able to graduate into something a little bit more definitive.
Well, it's good to know that. Imagine. Okay, next headline, and I have a heart drawn here with a pretty happy face on it because it's talking about mangoes, and I love mangoes. Eating 2 servings of mangoes each day may help support postmenopausal heart health by lowering blood pressure and bad cholesterol levels. Wow.
Yeah, mangoes is sort of part of this Mediterranean anti-inflammatory DASH diet that we're going to be talking about a little bit later.
Yeah, so you should go to the grocery store and get some mangoes for me.
And we can mix it in with your liquor of choice, right?
Absolutely. That sounds good. Okay, now we're going to talk about something very serious. Blood pressure. Everybody talks about blood pressure, but pediatric hypertension is an unrecognized condition and it is common. The problem with children having unmanaged hypertension or elevated blood pressure is that it adds a pressure burden to their cardiovascular system and kidneys for a longer time because they're going to have them every year as they go along. The diagnosis missed in up to 75% of children tested.
Right, you'd never believe that a kid would have hypertension, but in today's society, sedentary, processed foods, high sodium, obesity, all is leading to this epidemic. So if your kid's out there in television land, get their blood pressure checked, especially if it runs in your family.
And you said a bunch of those things, but also too much sodium, poor sleep, energy drinks, sugar, and genetics to some extent.
The list goes on. You got to pick good parents.
Yeah, I guess so. What to know about an anti-inflammatory diet? Eating less processed food, we talk about that all the time, alcohol, less red meat, and consuming more plant-based foods may help manage inflammation sometimes.
Most illnesses that we face today are because of inflammation of the blood vessels. High blood pressure, strokes, heart attack, and even cancers, for example. So I think it's important that we change our diet and the role of antioxidants because they're anti-inflammatory. We're going to put up a quick list of foods you should eat. And here are the foods afterwards that you should avoid. And some of the diseases that a anti-inflammatory diet can help, of course, would be rheumatoid arthritis, psoriasis, asthma, Crohn's disease, inflammatory bowel disease, thyroiditis, lupus, diabetes. Anything to do with the vascular system is going to be helped by an antioxidant, anti-inflammatory diet.
That's all you have to say, huh?
That's all we have to say because our first segment is done already, the fastest half hour in television land.
I didn't get to, well, I'll do it next time.
Next time always comes at It's Your Health. We'll be right back after this brief commercial message. Thank you.
Did you put that on there?
After
Sometimes keeping my mouth shut? Are you telling me I thought I was here to help you, not to be quiet?
There was a song in the 60s, you talk too much.
Oh, never
You're-
mind. Let's talk about some. You hungry? I have a chocolate bar.
Oh my favorite.
Would you like to see it?
This is from a 60th wedding anniversary you went to recently. Bonnie and Joe, you know you're out there in television land. And so part of what they gave us was nutrition facts on this candy bar, which of course is 60th wedding anniversary. A lot of patience, compromise, laughter, and love. And that's what the
Each one
ingredients
is worth 25%, by the way.
Very good. What would our candy bar look like? A lot of nuts. You would think so, huh? All right.
Never mind.
Moving
I
right
have
along.
nothing to say. Okay, chronic cannabis use, including edibles, linked to endothelial dysfunction. Chronic cannabis use is bad for your heart, whether you smoke it or consume edibles. And the suggestion that it's benign is false. Now tell us what endothelial dysfunction is.
Well, it's your blood vessel, and it inflames them, and we already talked about inflamed blood vessels are bad, so it could conceivably lead on to stroke, heart attack, problems with your kidneys, dementing type of things. This is not a benign issue, so I would try to limit, if not start at all, on ingesting things that our bodies are not designed to take care of.
Okay. Vitamin D, and we've heard about that, may slow biological aging and help you live longer. How about that? I know I'm taking vitamin D because you told me I had to take it, so tell me why.
You live in northeastern Pennsylvania. Virtually everyone is vitamin D deficient. In fact, some insurance companies say don't even measure it, just give them vitamin D. But we can measure it, and
Is that because it rains and we never see the sun?
absolutely, as opposed to down south. So yes, vitamin D is one of those crucial elements that you need, not only for bone health, but it does a lot of other good things.
And do you get D3?
I would get D3, yes.
Why?
Because I said so.
Because you okay, next headline. Write your own obituary. While you're still kicking, put together what your obituary is going to be. Start with your epitaph. Write 3 things about yourself. And then talk about your strengths. Maybe tell a joke. Talk about your hobbies, the lessons you've learned. Give gratitude to people. And some even give some no-nonsense advice before they leave. So sometimes it's interesting to read the obituaries. Some of them are very good.
Mine would say, I never met a man with so many faults.
But we loved him anyway.
Is that right? Okay.
How's that?
Enough said.
Okay, we're going to talk about naturally losing weight. Lifestyle changes such as regular exercise has a better chance of helping you lose weight than anything else.
Here's a list of things. We're going to go through them rather quickly. 10 ways you can lose weight without these GLP-1s and such things like that. Intermittent fasting has been shown to do so. Tracking your weight, diet, and exercise. Weigh yourself and you'll get positive reinforcement by the fact that you see the numbers go down.
People hate to do that.
Eat mindfully. Don't eat just because it's there. Eat when you're hungry. Protein with your meals. Try to stay away from the carbohydrates. They're a problem. Cutting back on sugars. Plenty of fiber also helps. And balancing your gut bacteria. Stress levels are also important. There's a lot of stress eating out there. People tend to think food is love and they eat a little bit more. And of course, our favorite, regular exercise, right?
And you always say food is love.
I mean that. That's why your nickname is Food.
Uh-huh.
Okay.
Oh, I see. Okay. Speaking of which, we're talking about not too much sugar. Well, I brought a drink with me. Have you ever heard of Coca-Cola?
Yes, I like it.
You've heard of it.
Yes.
Do you believe it?
Yes, I believe it.
Do you think it tells you truthful things?
When asked, yes.
Well, look what mine says.
Oh my. Better half.
That's me.
Well,
This is my bottle, and it says I am the better half.
well, which half am I getting?
You're getting whatever is left over.
Okay.
Okay, we'll go on with our
Absolutely.
reports. Daytime sleepiness is tied to higher mortality risk in middle-aged women, and we're talking about women in their 50s and their 60s primarily. Do you want to talk about that?
Well, it's a sleeper diagnosis, no pun intended. We're talking about sleep apnea. And what happens when you go to sleep is the tongue can roll back, partially obstruct airflow, you'll snore, and your oxygen levels will fall, which stresses everything. Let's face it, how long could you stay underwater? No more than 30 seconds. And people will stay underwater, if you will, low oxygen levels for minutes at a time, or even stop breathing. And keep in mind that women have breasts and have to elevate their chest, which can augment and magnify obstructive sleep apnea. So get a home sleep study, and you're going to avoid bigger issues such as pulmonary hypertension, dementing illnesses, stroke, heart attack, a whole list of things. It can also cause more anxiety and depression and fibromyalgia type symptoms. The list goes on and on. Get a sleep study, make sure you don't have sleep apnea.
Wow. Speaking of sleep, could a sleeping pill help prevent toxic tau buildup in the brain? There's a new study found that a medication commonly used to treat insomnia may not only improve sleep quality, but protect the brain from the buildup of this protein tau.
Right, that's sort of the protein that gums up the neurons in your brain, causing a dementing illness. I don't know if I can really believe this study, but nevertheless, they're saying that this medicine called the Vago may actually help in terms of not getting a buildup of this toxin in your brain. I'm not a fan of taking medicines for sleep, by the way, but nevertheless, that's for your information.
Okay. How might your daily coffee influence aging? Drinking coffee may increase women's chances of not having major chronic disease and physical or mental limitations as they get older. And coffee grounds are great for your potted plants. Go ahead.
I don't have any potted plants.
No.
But nevertheless, it's one of these things that's like eating meat on Friday. Before, coffee was bad, and now it's good. So wait a little longer, and those winds will change again.
Okay, let's take a break and stop what we're doing until we come back for the next part.
Good advice, sweetheart.
Thank you.
You're welcome.
He said something nice to me. It was a compliment.
Hang on to it.
Okay. We'll be right back for the next section of It's Your Health. Don't miss it. Welcome to the last segment of It's Your Health for today. And I just love the cartoon that's here because she's in bed with the dog and he's laying on the floor with a pillow and he wants to know if everybody's comfortable. Now, the only difference for us is now we have 3 dogs that want to sleep in the bed with us.
So my chance of getting in bed is next to nil. You're right.
True, that's true. Let's do headlines
Life
instead.
imitates art.
GLP-1 drugs linked to age-related macular degeneration. A higher risk of wet age-related macular degeneration. I know somebody who has this and it's awful. Their potential risks to eye health are not well understood. People who took that drug were more than twice as likely to be diagnosed with wet AMD.
Well, the Ozempic, Wegovy, Zepbound, these GLP-1s have been associated with badness, and this is one of them. And so the list goes on and on and on. And so it's getting harder to give informed consent to patients to say, are you sure you want to take this?
Yeah, and speaking of that, here's another problem with them. Ozempic teeth may cause tooth decay and other dental and gum diseases. They say that dry mouth, vomiting, and low appetite are causes of side effects. Proper oral care is a must. When you have dry mouth, nausea and vomiting, malnutrition, vitamin C, D, and B are crucial, especially if you're not getting them. So Ozempic, again, now we have to go from being a doctor to being a dentist.
Right. And so, for every reward, there is sometimes a penalty. Just like marriage, right?
What's your penalty?
A living hell. Who used to say that?
My
All
mother.
right.
My mother, not me. Let's talk about a certain supplement that people take that they probably shouldn't take. And it's one that I love. Now, I love this just to put on some bread or to put on some cereal. And we're talking about cinnamon. So if you use cinnamon just to spice up whatever you're eating, that's okay. But if you are taking it as a supplement, the compound in cinnamon supplements interferes with how your body processes the medications you're taking. Regular old cinnamon doesn't do that. And when you take the supplement, it can reduce the effectiveness of common drugs or amplify their effects.
And that's why when you go to see us, I say put everything in a brown bag. Not only the medicines that are prescribed, but the supplements that you're taking, because the supplements, although thought to be beneficial, could actually be harmful where you get drug to drug or drug to medicine types of interactions. Not good.
And look at one of the things that they say. They say more is not always better.
What are they talking about?
I'm not sure. I thought maybe you would know.
You'll have to show me.
Okay. More is not always better. I have to remember that.
Okay.
Okay. Common occupational upper extremity musculoskeletal disorders. I'm finished. This is all yours.
The key word was work, so we know that you're not involved with that.
No.
4 things that we commonly see in the workplace: carpal tunnel syndrome, tennis elbow, rotator cuff issues, and what's called a trigger finger. We see a lot of carpal tunnel, and people will say, well, I get numbness in my fingers. Here's a diagram of the most common areas that get numb when you have carpal tunnel. And so each one is treated a different way. Check with your healthcare provider, maybe seek orthopedic consultation. But these are some of the common things that we see for people who use their hands and arms.
Yeah, but I had to have both of my shoulders done, and I don't pick up heavy things.
You're right, you don't pick up heavy things.
That's not what I meant.
All right, well, moving right along.
Moving along, we'll talk about pacifiers. Not things that pacify you.
Oh, okay.
Pacifiers for babies. Self-soothing pacifier use while sleeping reduces the risk of sudden infant death syndrome. They improve the equalization of middle ear pressure if you're traveling. And if they're taking the pacifier and it falls out of their mouth, let it out. By the time they're about a year old, you should be doing away with it, hopefully.
Do things that happen, can it affect your dental health, for example, or a kid can get used to these types of things?
Oh yeah, if you're on it for too long, it can affect even the way your teeth grow. Mm-hmm. So you have to be careful about that. Malocclusions.
Gotcha.
I don't know what that means, but I have a feeling it's teeth.
Yeah, crooked teeth.
Okay, here's one that we don't agree on. The innovative solution to the growing student mental health crisis in the United States. It's a loss of independence in children, and it increases mental disorders. Children are the result of parents who don't let go. Children need more opportunities for independent activities, and they're more happy in the short run because activities engender happiness. The real problem is we just don't let our kids do anything on their own, and it makes them anxious.
Well, you know, when we were growing up, I would take my bicycle out, take it to school, take it to be an altar boy. We would put the glove on the handlebars go out and play ball and be on our own, go into the strippings and roll tires down them, and came in at 10 o'clock when the fire whistle blew.
That was back in the 60s. The world is not like that anymore. It is not safe to have your 9, 10-year-old on their bike alone out in the world. I know they're saying they need their independence, but there's got to be some other ways to do that than to have them be like they were, how many years ago? 50 years ago? 60 years ago?
It wasn't that long.
Yes, it was. So,
Well, it's a tough world. You know, you have helicopter parents and the world isn't safe anymore. So somewhere there's got to be a compromise. You're right. And we have to have our compromise to say goodbye, sweetheart. It's the end of another
we
action-packed
say
show.
goodbye, sweetheart, to Sammy?
Never, never. We're joined at the hip.
Okay.
We go way back. We've been doing this a long time, haven't we?
Yes.
Well, it's because of you out there in television land giving us your support and
Because you stop and talk to me. I love that.
okay. Thank you for joining us, and make sure you check with your healthcare provider before doing any of the things that we talked about here on It's Your Health. Thank you for allowing us to come into your home, entertain, and inform you. Right, sweetheart?
Right, Stanley.
Say goodbye, sweetheart.
Goodbye, sweetheart.